Back. My name is Linda Alela, and this is Pledge Watch on TV47. Now, Kenyatta National Hospital was built to fulfill the role of being a national referral and a teaching hospital, as well as to provide medical research. Established in 1901 with a bed capacity of 40. Over years now, KNH has grown in leaps and bounds, and with its fair share of floats, today it is East and Central Africa's biggest referral hospital. What can be attributed to this growth, and how is the facility contributing to the growth of the health sector in Kenya? Tonight, the CEO of Kenyatta National Hospital, Evanson, joins us to expound much more, and most importantly, we get to know what it is that the facility is doing towards ensuring that it contributes to the fight against COVID-19. Welcome aboard. Thank you so much for finding time, sir.
Thank you.
Yes, and we go straight to it. Out of the 34 CEOs that have served the hospital for the longest of time, only 3 left in clear circumstances. What does it make you feel to be the CEO of Kenyatta?
Well, it's a dynamic job.
Right.
It is it's unpredictable, and sometimes we are judged harshly by the society.
Right.
Sometimes you carry a burden, as usual. When you are the team leader,
right,
all the soldiers are behind you. So if one soldier messes backward or behind you, then you carry the burden. And most of the time that has been the case. However, it's a job, it's a service to the mankind, and somebody has to do it. And that's why we are doing it.
All right, it's taking us back to the times of Lily Koros and Dr. John Ongech, who at some point in time was, appointed to take over, after that suspension of Lily Koros, but suddenly said that, no, I will not take up this challenge simply because, it's a cartel-driven entity. Do you suppose this is the case? Or one would argue, have you been instilled by the cartels?
Well, I wouldn't say that it's a cartel business, and I've come to learn people talk what they know, people talk what they don't know. And more often than not, when you don't know something, then everybody knows something about it. And we've been asking, where are these cartels?
But he's been at the top of the helm. He understands the activities in Kenyatta National Hospital, being a doctor.
I will tell you now, and I will tell you without fear of contradiction, right, that the government that we are running now, we run with guidelines, we run with the acts of parliament, we run with the laid down rules and regulations.
Right.
Most of the procurement, for example, are governed by Procurement and Disposal Act and the PFMA, something called the PFMA. And you cannot work beyond that. And if somebody, and I've been telling people, if you want me to work beyond that, don't waste your time. I work within a guideline, and that's what we'll do. If it is a tender you want, please come and advertise. We advertise tenders like any other person. We advertise jobs like any other person.
Right.
If you want to participate, and Kenyatta is a public entity, and it's open. We use open system, apply like any other person.
Right.
I will tell you, even now, I'm the CEO, but I'm still also a clinician. I'm still doing my clinical work. So anybody who wants, don't come waste my time that you want me to do you favors. Participate like any other Kenyan, and we will have a fair play without trying to find how you can alter the systems. We have tried to put all the systems now in place, and we can tell you that most of the things are done overboard.
Right.
You've seen even now the board is participating, and the ministry, we are also having a very close link with the ministry and even with the county. So there is nothing we are doing in isolation as Kenyatta National Hospital.
All right. Okay, we'll delve deep into that as we proceed. But most importantly, we get to ask this question. Mid-COVID-19, the crisis in the country, there was that declaration or that order by the government or the Ministry of Health that, a bit we adjust in terms of, the health sector, the facilities across the country. Would want to know whether there was that adjustment in Kenyatta National Hospital and what the impact has been so far.
Adjustment of what?
Adjustment in terms, of the services that are being offered right there. At some point in time yesterday, we received reports that yes, now Kenyatta National Hospital is fully functional, contrary to what has been since that time that, of course, COVID-19 hit the country. And this was communicated by a senior official within.
Well, first, information travel in different circumstances. Right. But if you had followed backward when the chairman, the then chairman, Engineer Nicholas Ngumbo, he said very clearly that we did not stop the services in Kenyatta. And we cannot be able to stop services in Kenyatta, with or without corona. Even the time of when there was fear of Ebola, we did not stop because Kenyatta cannot stop even one day. We cannot even close. And if you have noted, even when there is industrial dispute among workers, we still have to continue with functions in Kenyatta. Why? Because Kenyatta plays a major role, and most of the cases that we deal with are not cases to be handled by any other person. We are a specialized hospital. We deal with acute and severe emergencies. I don't know whether there is something called severe emergencies. We deal with life-threatening cases. So that tells you that we cannot close. Like now, with or without COVID, people are still getting accidents. Where are they going? With or without COVID, people are still getting hypertensive strokes. People are still getting blocked arteries, and somebody has to open them up. People are still getting appendix. What we are saying, women are still delivering. People are still getting complications of delivery, and we cannot stop that even with or without COVID. So what we did, and we have also, other than those critical cases, there are those patients we call routine patients. They are those patients we run outpatient clinics, medical outpatient, surgical outpatient. For example, maybe we operated on you last year and we have to follow you up, and we do routine follow-ups, either monthly, 2 monthly, or something like that. Those are the ones we told them, because you are stable, we can actually have a mechanism of following you up to make sure that you are okay, so that you also don't come and increase the traffic, which will expose you more. There are also some patients who have some immune problems. For example, there are patients who are diabetic, there are patients who have HIV, who are on treatment, there are patients who have TB. We would wish that we actually organized and made a system so that we can actually follow them up, so that they can still get the service without coming and increasing the traffic. But there are others we did not stop. For example, cancer. And I've been hearing people saying we have stopped cancers. And if you listened in the morning, I said, what we even did, now that the numbers reduced for obvious reasons. One, fear. People fear coming to the hospital, and also they also respected the order that please let's avoid unnecessary movement. And then there is the blockage. There is the movement that was stopped from entering Nairobi. That automatically brought the numbers down. However, we took advantage of this time. And most of the pending cases, we had pending cases of, for example, cancers of the breasts who are waiting for surgery. We had people who had cancer of the esophagus who are waiting to be put stents so that they can be able to eat. Those were a number of patients. We have done something called an RRI, so that we can actually reduce now those pending cases who are many, and we could not keep up with the numbers. Even and from next week also, we are now doing another RRI for orthopedics. Our orthopedic wards have been very congested because all these accidents, that's where they go. Now we are actually doing another RRI. What I mean is RRI means Rapid Response Initiative, so that we open a number of theaters, we start doing most of operations on those specific areas, so that we can also now take advantage that the wards are not crowded. We now operate on those cases while the numbers are still down. Of course, our numbers have come down for one, as I've said, but what I'm trying to say is that we are still giving the services. We have even gone ahead and opened a WhatsApp system, SMS system, and we are even piloting what we call telemedicine system, where now some of the people who are in the diaspora, Kiambu, Muranga, Nyeri, and they have been our patients, we are actually connecting them so that we can actually try to give them service remotely. We can service them remotely. What else also we have done, and we thank the government that we were given Odaya. There is Odaya level 6. Now it's called KNH Odaya. Most of the patients who are from that side, we are also directing them there. They don't have to come to Nairobi. It is easier for us to send specialists there. So we are sending doctors there. We also have consultants there. But we are also sending a number of specialists there to attend to those people in Odaya. That is still our branch in Odaya. So all these have actually helped so that we can continue making sure Kenyans get value for being Kenyans.
All right. In a bid to tame COVID-19 again, these patients who walk into hospital, there's that declaration by the government that, one, they should be tested. So, supposing I walk into, of course, Kenyatta National Hospital today, or the facility today, what will be the testing cost in the facility, or it is as free as maybe has been declared by the government as well?
Well, one thing I want to still clarify, and Waziri clarified there, we are doing something called targeted testing.
Testing, yes.
Targeted testing means the epicenters, the places that we are recording many cases, we are actually going to do mass community testing.
Contrary to that, sir, there was also that declaration that when you are going to hospital to seek medical advice, or medical services, then it means you need to be tested first before, of course, you get services in regards to what has taken you there. We
are going to do that, but at the moment, what we are doing, for example, in Kenyatta National Hospital, when you come for other problem, we do something called triaging. Triaging means we first eliminate whether you have the tendency, could you be one of the culprits that could be having COVID? Because as you know also, the process of testing is an expensive affair. And you heard the Waziri saying, actually, the actual cost of testing COVID would be something close to 10,000, between 8,000 and 10,000. However, it has been significantly complemented such that even what we are charging now for hoteliers and such, it is grossly discounted. However, for patients, we are actually doing it for free, courtesy of the Ministry of Health. Because the Ministry of Health is providing the kits, we are providing the human resource and the process, and also the Ministry of Health is also providing those lab personnel so that the tests can be done.
All right.
So this has really been discounted, and it is good that people know that most of the people who have come to the hospital, most of the people who have actually had corona per se, the ones we have tested, and I can tell you, you can challenge, all the people who have been seen in Kenyatta, we have not charged them because the Ministry of Health has been taking care of that. That is for the sick patients.
Right. So, of course, approximately how much would a person who's working in, probably is supposed to, work in a restaurant, be charged at this stand as we speak? The other time I was at Bagavi, and, there was still some hitches on how this is going to be charged. So far, do we find a clear answers to that?
So far, we rely, as I told you, Kenyatta National Hospital works under the Ministry of Health, and we work under the umbrella of the Ministry of Health. Once a decree is done by the Ministry of Health that will be charging 1,000, for example, for the hotel workers, for us, we have no choice. We are relying on to that, because by the time the Waziri is saying 1,000, it means he has put measures in place so that the cost is somebody else is taking care of that cost. And the Minister of Health is, and as you heard Waziri Barala saying yesterday, they have had a discussion, and because of these are extraordinary times, it calls for extraordinary measures. So the government is actually putting those extraordinary measures so that it can buffer or it can cushion most of these people from hotel industries.
All right. And Dr. Kaburi, it is International Nurses Day. We celebrate them, of course, for the exemplary work that they have done. It is cuts across, all the frontline workers. So we'd want to know, what protective measures have you put on board, to ensure that the healthcare workers are well catered for, even as we speak right now?
Well, as I was saying, first I want to congratulate my nurses, and I say I love you all. And as I said, I have worked in many parts of the world, and I'm yet to find nurses who are as hardworking as the ones I have in Kenyatta. Wow. Of course, they are the majority, and but they work with their blood, they work with their hearts, and I would also urge the public to support them and embrace them, and also support the work they are doing, because 90% of the services they offer is actually from inside their hearts. Mm-hmm. And the earlier we get that, the more we will understand them. Yeah. As a hospital, we embrace them. And two, as a hospital, they are also given the necessary training. We do capacity building for them. We do career development for them. We are one of the institutions that really respect career development of healthcare workers, from the nurses and even other cadres. And also, we have also taken care of in terms of protection, the protective gears. Yes. We have given them masks. We have given them the areas that need coveralls. We have given coveralls, and we are even going ahead now. We are, with this COVID era, we are also now starting to give them scrubs so that they can be leaving their clothes at home. At this moment in time, we have also organized, after the shift, we are transporting them home so that there is no inconveniences in getting to their loved ones in good time. All this is making sure that they are comfortable. And we are, not to forget, we are still paying the salary as it should. Mm-hmm. Yeah.
Okay, speaking of which, brings us to the point of money. And one, lots of allegation in regards to what has been happening in Kenyatta National Hospital, to a point whereby it's been pointed fingers at, with the aspect of saying that, is it a money-meeting entity, based on the cases that we have witnessed down there. I mean, what would you say of this allegation? I mean, does it hold water in any way?
The first thing I want to tell Kenyans, we are not paid. Kenyatta National Hospital, there is no staff who is paid by the number of patients they see, right, or by the number or the complexity of the case. Mm-hmm. In fact, and I want to challenge, other than the people in finance, most of the people who work in that hospital, if you ask them how much do you charge a consultation, mm-hmm, how much is a bed, they may not know. Because for us, money is not an issue. Mm-hmm. Most of the services we render in Kenyatta are grossly subsidized. Actually, if you look at even the types of operations we do and how much we pay, we don't even break even. Why? Because these are government organizations, these are government infrastructure, and most of us are actually government workers. Which I actually refute when people say that people come at, you will not be given services unless you pay. I want, and I say, you who is paying, come to me and show me that person who is asking for you money so that you can be fast-tracked or you can be seen. Such things shall not happen. The system we have, and in fact, if you must know, and anybody who is listening, Kenyatta, we run a cashless. Mm-hmm. We run a cashless system. So if somebody is asking you for money, just know that is not even a Kenyatta worker. Mm-hmm. We don't see people because, and we also have no respect of a persona. Everybody for us is a patient.
While this could be obvious, sir, this could be an obvious question, I mean, what then brings in the difference between those ones that are in the private wing and, the other ones?
You see, those are two things. And these are, again, two things I want to clarify very clearly. Right. Kenyatta also has a private wing. We call it a prime care service. That is totally different from actually the normal hospital. Okay. This is a private wing like any other private facility in Kenya. It is on 10th floor, and they even run, this facility has actually no link with the common hospital. Mm-hmm. It actually runs a parallel. This was created so that we try to bridge the gap, so that some of the proceedings that actually are earned there, they are actually trickled down to improve services in the rest of the hospital. And why did we start this? Right. There are people who can still afford more. In the society, as you know, we are equal, but some people will also offer more effort in doing something else. There are people who still wanted Kenyatta services, but they would want to pay more. Those people who want to pay more, that's why we created only level 9 and level 10, so that bridge, the proceedings that we get from 10th floor, we use it normally to improve further the facilities in the other levels. On the other hand, there are people who would want to use the Kenyatta National Hospital facilities but are forced to pay for more when they are referred to, say Doctors Plaza, they are referred to private entities that again are run by the very same doctors within. What would you say about that? Again, Doctors Plaza is also an entity. There is no facility. Even Nairobi Hospital has a Doctors Plaza. Even Mata Hospital has a Doctors Plaza.
What
even
about being sent to private entities?
All those hospital infrastructure have a Doctors Plaza. Right. The reason why we created a Doctors Plaza, when doctors work, for example, when they finish their work, yes, we created that so that we could also try to keep them within the environment, such that in the event there is an emergency, we don't have to crisscross from because we still not stop them from going to do their moonlighting anywhere. And this is something that was started long time ago, the 90s. It's only that it has peaked with the time, and we actually started it so that when they are around there, in the event that you have to do something in the world, you are called, there is an emergency, you just cross in and you close out. Yeah. All right. Let me refer to this, and they say about 10,000 Kenyans seek medical treatment abroad, spending over 10 billion. And sometimes these healthcare services are available right here in the country. Do you suppose that Kenyans are well informed of the services available in the country for them? Well, again, knowledge is self-driven. Information is also self-driven. You have to seek the information. But the other thing is choice. Normally, prophets, there is a saying that prophets are not known at home. As much as we tell people, like now I will tell you, very few people do as many renal or kidney transplant like us. And in fact, even now is the time we are trying to do liver transplant. You've seen the complicated operations we've done. We separated the twins the other day. We joined hands. Some of the operations that we do cannot be done anywhere else in the world. And in fact, when we record, everybody wonder, how can you be the ones who are doing it? It's only that we need some level of education. And who will educate the people? The people to educate is, first, we start with the fourth estate. Unless people listen to you. So the stories that you give, if you can give the story, you can give the same weight about people going to India. If you can give the same weight about how many kidney transplants we are doing and how much we are charging, then people will know. And in fact, what I would want to tell Kenyans also, please note that most of these people who go to India, eventually they still come back to us. Because even when you are transplanted, when you do an organ transplant, it doesn't end there. If you are given a kidney, we have to follow you the rest of your life. Most of them, they are still with us. And what we are trying to urge Kenyans, and I will challenge any Kenyan who would wish to come. We have opened Kenyatta. We are running an open system. Please come in and visit. See the facilities that we can offer. Right now, we have even expanded. We have expanded the facility for kidney transplant. Most likely, we'll now be doing maybe 4 or 5 kidney transplants per week. Please come and see. We have opened the sector of cardiac catheterization, where we can actually operate you without opening you up, what we call invasive operations. Right now, facts be told, there is nobody who does as many radiotherapy as Kenyatta. And we thank God and we thank the ministry that they have been supporting.
Dr. Expansion comes along with communication, proper communication, that it gets to the people that it is intended to help. So what are you doing as an entity also to ensure that, as much as maybe the public is not aware, is not proactive enough to get to know this, I mean, this information gets to them?
What we are doing is like what I'm doing now.
Yes.
How you came to make me talk to you,
right.
That's what I'm doing.
Okay.
2, we have engaged now a vibrant young communication and marketing manager who will also be giving these stories. But the other thing I want, you see, we need you people to come also and find stories. Most of the time, how do you find stories of people, an accident? You actually go to harvest stories. We would want people, we are not closing the hospital. We want people to come and see what happens in the hospital. I like some of the journalists who actually come and follow a procedure of how an operation from the beginning to an end. The other day you saw us operating a gentleman without a very huge person. And we remove the stomach so that he can become thinner without doing all these exercises. These are operations that make people go abroad.
Is it as open for journalists to do that? Because sometimes the procedures before you get this, a go ahead or nod to proceed and come and film some of these things is quite hectic.
What I've told you, if you are, I don't know how much Bible you know.
Yeah.
The Ark of the Covenant,
yes.
the Ark of the Covenant, the piece of cloth when Jesus died,
right.
It opened. It means people could see what is inside.
Yeah.
There are a number of things that the medical field has opened, including husbands now enter the delivery room to see the wife delivering.
Right.
The same thing, we have allowed some of these things. We have allowed journalists to come and see, especially when the confidentiality of the patient is not infringed. We have allowed people to come and give Kenyans the stories. Some of these things that you believe it is like miracle, we want you to see. And also we want people to appreciate how much these health personnels do, so that when you see that somebody is tired, you can understand actually what is actually making them real tired. And you can also find how much dedication they have when they are serving you.
Okay, 2 key questions before we get to wind up, Dr. And one would be, lots of mishaps have not been addressed, in regards to how Kenyatta National Hospital has been conducted, lots of issues and terrible reports bedeviling it. I mean, so far, what are the plans that have been put in store towards ensuring that at least this entity is able to restore sanity, taking us back to the times that were, where we have patient sexual harassment, allegations, we've had stealing of babies, negligence, security aspects. I mean, lots of issues.
Well, I will tell you again, let's look at it the other way around.
Right.
Who is communicating the message?
Okay.
Who is the complainant? We have always been alleged to have. For example, when the issue that we alleged that we are raping people, the people who, how did the story die? Because we came and asked them, look at the CCTV. These are the ladies when they were moving from the nursery. Right. This is where they were breastfeeding the babies. This is the ward. Show us where they were raped.
But equally, at some point, a man stabbed around 40-something times while in the facility.
Again, I am telling you, these are like what people must understand. Kenyatta National Hospital is within the society. What is out there is also what is inside there. The same Kenyans who are outside in the streets are the same ones we are treating. So you will find a thief within that. Like now, I'll tell you, at any given time, visiting hours, every lunchtime, we see 20,000 people coming in. Yeah. So you expect within that 20,000, that's a whole constituency. You will expect there is a thief, there is a mad person, there is a murderer within. So when in a society such one case happens, we should always ask, what is it that could have happened? And then the allegations, when you say that such a thing happened, please always look forward and find yourself, find the story, the real truth before you can. And of course, bad news is good news. Good news is never news. Right. So, and that's why you will see what moves like a forest fire is actually the things that that has sweetness, has salt, the story that has salt, but the real truth never moves. And once the truths come out, the story dies. So we would wish people, people always, before you even say something, make sure and double cross it that for sure this is facts that you are saying before you bring things to the public. All
right, Kenyans are convinced tonight that they are safe anytime that they march into, Kenyatta National Hospital in search for, healthcare.
What I can assure you, and I will tell you, when you come to Kenyatta, trust me, you are safe. I will tell you, even me, myself, Kamuri here, if you go to my car, I've put a sticker, in the event of an accident, take me to Kenyatta. Because that is only place where nobody will first ask whether you have an insurance, whether you have NHIF, whether you are from where, whether you have money. We first look at life first. And that's why I said, for us, money, we don't, even when you come there, we will not first ask you whether you have money. For us, it's first to make sure you live. And I said the other time, the first few minutes of an accident are very important. So when you come, for us, you are safe. That was all I can tell Kenyans.
Okay, now Kenya is one of Africa's top beneficiaries of cross-border travel for medical purposes. Is this attributed to private or public healthcare? And what are you doing as Kenyatta National Hospital, one, to ensure that you get the benefits of this? And what can we as well do as a country to ensure that we equally leverage on this?
Well, what I will tell people, for us, we are trying to modify the services so that we give value for your money.
Right.
We want, and that's why part of the thing we even did the private wing is so that we can tap these people who are moving. We can actually get the services rendered here. Right. We have also improved the insurance system so that actually the people who have insurances out there can also benefit from the same subspecialties that we are offering. And then, as I've said, we have opened. Once you get a genuine referral and we think Kenyatta is the one that can give you the services, trust me, you are better in those hands than anywhere else.
All right, still so much to discuss in regards to Kenyatta National Hospital, but we say thank you so much for finding time to be here with us, Dr. Evanson Kamuri, the CEO Kenyatta National Hospital. Still so much, like I said, but then this particular evening we're going to wind it up at that. It was great having you, and you can look forward to the next show, that is Tuesday. Take a look at, of course, who's going to be coming next in regards to matters politics this time around. As we said, Pledge Watch is all about putting to task the leadership, whether appointed or, of course, based on the aspect of being elected. It was great having you. My name is Linda Alela. Thank you so much once again for your company right from the time we started up until now. Sign language interpreter Anne Wairimu. See you again next week.